it is that's a good reminder, just to let you all know that we are recording the meeting, so you can look it up and send the link on to your friends and colleagues if you'd like to. For those that don't know me, my name's Liz Darlison, and I'm the CEO of Meso UK, and also nurse consultant at the University Hospital of Leicester. I think this is our maybe 7th webinar that we've arranged. There's been some good things that have happened as a consequence of COVID. I think that, you know, we've definitely become a far more virtual organisation, which means we've been able to reach out to people more often. I think these kind of things will continue. Well, I hope they will. So just a little bit of housekeeping before I introduce Claire and Beth. Just to remind people, if you wouldn't mind, we'll put cameras off, I think, for the presentation. And in the chat facility, which is at the bottom of your screen, if you've got any questions for the speakers, if you want to just type them in there, then I will ask them on your behalf at the end. And if you struggle with the chat facility, if you just drop them, send them in an email at info@mesothelioma.uk.com, then Julie will forward them on to me as well. We have Action Meso Day this week on Friday. I hope some of you have managed to link in with some of the events that are going on around the country. Been a big national effort put together by the UK Meso Alliance and led by Paul Cook. So I'm looking forward to seeing all the material that they have put together. And Lorraine and I are going to be hosting a bit of a sandwich event from Meso UK as well on Facebook Live. So I'm looking forward to that on Friday. And I think, did I say, Lorraine, this is our 15th Action Meso Day? I think it is. I think the first one was in 2006, and some of you will have been involved for many of those since then. Anyway, sorry, Lorraine, what did you say?
Yeah, 15th,
I thought it was. So, okay, without any further ado, then it's a real pleasure to introduce you to Dr. Claire Gardner, who's a Senior Research Fellow and Co-Director of the Mesothelioma UK Centre for Research at Sheffield, which is based in the Division of Nursing and Midwifery in the Health Sciences School at the University of Sheffield. And also alongside Claire, Dr. Beth Taylor, who's a Research Associate, also in the same team at Sheffield. And many of you will have met Beth when she did research with us, going back a couple of years ago now. So both of them work in the Centre for Research, and the team there have been working over the last 6 months or so on a research prioritization exercise, the aim of which was to identify unanswered questions about mesothelioma patient and care experience, so that we can ensure that the monies donated to us for research and monies available for research are channeled into areas that are a priority for the very people that we seek to support and help. So I'm fascinated to hear a little bit more about the Centre for Research, and then also about the research prioritisation exercise that's been completed. So thank you. I think Claire's going to kick off. So thank you, Claire, and please, Beth, just follow on at your leisure once Claire has done her piece. Thank you very much.
Thank you, Liz. Thank you for that lovely introduction. I'm going to attempt to share my slides now. So just please bear with me whilst I get them set up. Can you give me a thumbs up, Liz, if that looks all right? Fantastic. The first hurdle is got over with the technology. Well, thank you, Liz, for that kind introduction, and thanks also for the invitation to come and speak to you all today and tell you a little bit about what we've been up to at the Mesothelioma UK Research Centre in Sheffield over the last 12 months since we opened our virtual doors in July last year. So I'm Claire Gardner, and as Liz says, I'm co-director of the Mesothelioma UK Research Centre, and I'm going to be talking for the first 10 or 15 minutes or so today about sort of the broad programme of research of the Research Centre over the last 12 months, and then Beth's going to talk in a bit more detail about the Research Prioritisation Exercise in particular. For those of you that don't know, the Meso UK Research Centre is very generously funded by Mesothelioma UK, and we were established in July last year. As Liz says, we're hosted by the School of Health Sciences at the University of Sheffield, and you can see here on this picture one of our beautiful university buildings that none of us have stepped foot inside now for well over a year, but we're looking forward to hopefully getting back in there when it's safe for us to do so. So I wanted just to start off by telling you a little bit about our vision for the Research Centre. And I think it goes without saying that we want to make sure that we conduct robust and rigorous research with a reputation for excellence. But I think our real fundamental priority is that the research we do is of benefit to people living with mesothelioma and their families and caregivers. That really is our number one priority. We want to make sure that the research that we do has an impact and is able to have some measurable change and improve the experience for people living with mesothelioma and their families. Another really important element of our vision is around building research capacity within the field of mesothelioma research. And I'll talk a little bit later on about some of the activities that we've been doing over the last 12 months to enhance and build research capacity. But it's we're very committed at the Research Centre to making sure that we build the next generation of mesothelioma researchers and help support research capacity in that area. So this is our team. As Liz said, the Research Centre is led by myself and Professor Angela Todd. We're joint co-directors, and I'm sure many of you out there will know of Angela and know of the work that she's been doing in mesothelioma over many years. She's very experienced and has a huge amount of expertise in mesothelioma. I am much newer to mesothelioma. I have many years experience working in patient experience research and working particularly in the area of palliative and end-of-life care. And that's an area I've been working in for over 10 years now. So myself and Angela lead the team, and then we have a fantastic group of postdoctoral researchers, Steph, Beth, Michaela and Mads, who you can see along the bottom there. We also have 2 PhD students, Virginia and Emily, and I'll tell you a little bit more about their PhDs a bit later on. Our coordinator, Angela, and then we have some honorary research staff as well, Peter and Matt, who are working on specific individual projects. So that's really our core team, but then we are supported by an advisory panel and also a patient and public involvement panel. And the advisory panel have been really integral to supporting all of our research activities over the last year. And that advisory panel is made up of a wide range of different people who have got expertise in mesothelioma, from clinicians to academics, lawyers, people from asbestos support groups. So we're really grateful to be able to draw on such a breadth of complementary expertise in mesothelioma. And as I said, that panel has been supporting us over the last 12 months in our research. We also have a patient and public involvement panel, or a PPI panel, and that panel is made up of people who have personal experience of mesothelioma, either as patients or as family members and friends. And it's really nice to see some of the members of both our PPI panel and the advisory panel on the call today. I'm going to talk in a bit more depth about the PPI panel in particular in a couple of slides' time. So I just wanted to give you a brief overview of some of our current projects that we're working on, projects that have happened since the Research Centre was established last year. I haven't really got time today to go into each of these studies in a lot of detail, but I'll just give you a bit of a flavour of some of the things that we've been doing. Beth is going to talk about the Research Prioritisation Exercise, so I won't go into any detail about that now. Beth is also leading on a study of mesothelioma in education workers, which is the MUSE study. And that study was really born out of some concerns that were raised to us by Meso UK, that they were had some concerns about the number of education workers who were being diagnosed with mesothelioma. So that project aims to look at that and interrogate that in a bit more detail. Of course, we couldn't have got through the last 12 months without acknowledging the huge impact that COVID-19 has had on all of us, really, and all of our lives and all of our the way we work and everything really about what we do. But I think COVID-19 has probably had a disproportionate effect on people who are living with mesothelioma. And we know it's had a huge and quite often devastating impact on people with mesothelioma. So we're involved in an ongoing study which looks at the impact of COVID, both on people living with mesothelioma, but also healthcare professionals as well, because we know there's been a significant impact on healthcare professionals. We're just coming to the end now of a study on palliative care needs in mesothelioma, looking at what palliative care needs are in mesothelioma, but also looking at the role of mesothelioma clinical nurse specialists in meeting the palliative care needs of people with mesothelioma. And that study is, as I said, it's coming to a close, and we hope to be producing the final report from that study in the next few months. So hopefully you'll be able to access that on our website if you'd like to know more about that. Our colleague Matt Johnson is leading a study on long-term survival in pleural mesothelioma. We're also doing some research, analysis of the MORE data. The MORE survey, I'm sure many of you are familiar with that. That was conducted by Meso UK back in 2019, and it really looked at understanding the patient's experience of mesothelioma and care and treatment, and we're undertaking analysis of that data, which will hopefully be published soon. And then finally, peritoneal mesothelioma, obviously quite a rare form of mesothelioma, but because of that, we feel it's perhaps received insufficient research attention to date. So that's an area that we're committed to undertaking more research in, and we're just embarking on a project looking at care and treatment variability in peritoneal meso. So that is a very, very quick overview of some of our key studies. If any of you are interested in learning more about any of these particular pieces of work, then please do go onto our website, and there's more information on the website about each individual study, and feel free to get in touch with us if there's anything there that you're particularly interested in. I just want to touch as well on some of our completed work. As I said, although the Research Centre has only been going for 12 months, Angela and her team have been involved in mesothelioma research for many years preceding that. And these are some of the studies that have been completed within the last couple of years. And we're now getting to the point with these studies where we're starting to see some really nice impacts being generated from the findings. So we've got final reports published, which you can download from the Meso UK website. We've got some journal articles, papers being published as well. And as I said, it's really nice to be able to see the impact that's being derived from these studies. Many of you will have heard of the GEM study around gender, the MIME study, which was looking at the experience of military who are diagnosed with mesothelioma, the MAG study, which was looking at mesothelioma in healthcare professionals, and then finally the radio meso study looking at diagnosis of mesothelioma. And all of these studies now are starting to generate impact, which is fantastic. For example, we know from radio meso that we now have guidance for how to deliver a diagnosis of mesothelioma, and that's being adopted, and that's having a direct impact on patients as they receive their diagnosis. Similarly, from the MAG study, we've very recently had some really nice impact from that, as we've started to see much greater commitment, I think, to supporting healthcare professionals who might be at risk of asbestos exposure. And there's been some great policy and parliamentary level engagement from that study. So just to give you a flavour of both what we're doing now, but also some of our completed work over the last few years. So I just want to touch now on tell you a little bit about our PhD students and what they're up to. So we have two students, Virginia and Emily. Virginia is a counsellor, and her PhD is around the experiences of family carers of armed forces veterans with mesothelioma. And Virginia is coming towards the end of her PhD now. So she's already published some really nice papers from her work, and one of those papers you can see is referenced here. Emily is just starting out on her PhD, and Emily is a GP, and she has a particular interest in palliative care, and her PhD is going to be looking at continuity of care in primary care for people with mesothelioma and how to better support that. If any of you are interested in either of these studies from Virginia or Emily, there's again more information on our website and contact details to get in touch. I'm sure either Emily or Virginia will be happy to answer any questions about their PhDs. And I mentioned earlier that, that our research centre is supported by a patient and public involvement panel, or a PPI panel, and they've been absolutely fundamental really to supporting our research activities over this first 12 months of the research centre. And I just wanted to tell you a little bit more about what they do and what their role is. So the PPI panel is made up of people who have personal experience of mesothelioma, and that includes patients and their family members, friends, interested members of the public who have a personal interest in mesothelioma or personal experience. And the reason we set up the PPI panel was really to ensure that the research that we're doing as a centre really meets the needs and the priorities of people with mesothelioma. And that's, you know, what we want to achieve is benefit, really, is impact for people with mesothelioma and their families. And the PPI panel work with us to help ensure that what we're doing does meet their needs and fits really with their priorities. If anybody out there is interested in being a member of our PPI panel, we absolutely would be delighted to talk to anybody who'd be interested in being involved. We're always looking for new recruits to work with us. So if you think this is something you might be interested in, then please do get in touch with us or have a look on our website. We've got more information on there about what the role involves and what the commitment involves. And as I said, we're very happy to have an informal chat with anybody who might be interested. The other thing I wanted to briefly mention about the PPI panel is that we don't see the PPI panel just as a resource for our research centre, but actually for any other mesothelioma researchers who are involved in research across the UK. So if there are other researchers out there who are involved in mesothelioma research and would like to gain a PPI perspective, then please do get in touch and we can help you liaise with our PPI panel. This is just some of the publications that we've had published over the last few years, really, and articles in peer-reviewed journals, which is great to see such fantastic outputs from our first year's work and from previous work. We've also had a really nice presence at academic conferences, both national and international, and we were really pleased to be very well represented this year at IMIG, which is the International Mesothelioma Interest Group Conference. They held a big international conference, and we were really pleased that we had, I think, 12 abstracts presented at IMIG, which it's really nice to see our work acknowledged in that way. Aside from our publications in academic journals and at conferences, we've had a number of other outputs and impacts as well over the first 12 months. We've had some really nice media interest and engagement, particularly around the launch of the Research Centre, which was really nice. And I think a real recognition that there's a need for research in this area. So that was really nice to be able to see. We've also had quite a lot of policy and parliamentary engagement, which again has been great to be able to engage at that really high level, to be able to influence policy and use our research findings to be able to do so. We've been mentioned in a few different parliamentary select committee reports now, most recently the select committee report on workforce burnout and resilience during COVID-19. We've also had questions asked in Parliament on the basis of our research findings and had some really great engagement from individual MPs and people sitting in the House of Lords, which has been great. We've been delighted as well to be able to speak at some patient events, including the Meso UK Patient and Carer Day and the Scottish Mesothelioma Network. As I mentioned earlier, one key element of our vision for the Research Centre is around capacity building and really trying to ensure that we have a vibrant and committed research community for very many years to come. And we've worked over this first 12 months with a number of students, both undergraduate and postgraduate students, who have worked with us on research placements and on internships, or just for informal mentoring. And it's really been great to work with such a large number of different students over this first 12 months to help them build their research skills and hopefully take that knowledge and expertise in mesothelioma forward into their future research careers. We've had some great international links and started to build some really nice collaborations with colleagues internationally, and that's again something that we can certainly learn a lot from here in the UK, but we hope to be able to share our learning with international colleagues as well. And then it goes without saying that, you know, we're 12 months in, so we're quite early on really in the cycle of our research centre, and we have huge ambitions for what we're going to achieve over the next 2 years. And we've got a number of studies in the pipeline and a number of grant applications in the pipeline, most of which are being informed by our research prioritisation exercise, which Beth is going to go on and tell you about in just a few minutes. So that was a very whistle-stop tour of what we've been up to over the first 12 months of the Research Centre. And if you want any more information about any of our studies or want to get in touch, then please do go onto our website and have a look at that. Please follow us on Twitter if you don't already do so. We have a lot of information on there about what we're up to. And then finally, we have a newsletter that we send out every couple of months with updates about what we're up to and our research. And if you'd like to sign up for the newsletter, again, please do visit our website and you can sign up for the newsletter there. I'm going to hand over now to Beth. I'll just stop sharing my screen. Beth, if you want to share your slides, I'll leave it to you, up to you.
Right, let me just set this up. Right, does that look okay to everybody? I'll take that as a yes. Okay, so it's lovely to be here. Thank you for having us. I'm going to talk to you about our research prioritisation exercise, which I'm going to call the RPE because it's quite a mouthful. And Liz introduced the aim of the exercise earlier on, so thank you. But I guess it's there on the screen. So we're aiming to identify unanswered questions about the mesothelioma patient and carer experience and to prioritise these to identify research areas of most importance. So when we say the mesothelioma patient and carer experience, we mean across the entire care pathway, so from diagnosis to end-of-life care and bereavement support. And so that will include experience of the disease, its management, as well as experiences of care received, services provided and support given. So all aspects of the patient and carer experience we're interested in. It may be helpful for me to explain why we decided it was important to conduct this exercise as a research centre. And many people will be familiar with the James Lind Alliance Priority Setting Partnership. I think it was 2013 that exercise was conducted, and it made a really valuable and significant contribution to understanding research priorities and improving treatments for mesothelioma patients. Like with all research, though, there has to be a clear focus, and the focus of that exercise was to develop a list of priorities in relation to treatment and interventional research. And that meant that research focusing on the patient and care experience couldn't be included. So as well as this, over the last decade, we have witnessed an increase in mesothelioma research and developments in treatments and care, which is fantastic. But of course, without research which focuses explicitly on the experiences of patients and carers, there is a risk that any new interventions or treatments or changes in service delivery may not meet the needs of those who are actually receiving them. So this research is really important. And despite the body of new research, there are, of course, still unanswered questions and research gaps that, if answered, have the potential to improve the experiences for patients and carers. So for us as a research centre, this exercise will shape the research that we conduct over the next few years to ensure that our work has the greatest impact for mesothelioma patients and carers. And beyond our research centre, this exercise will make a contribution to the broader meso community. I think Liz touched on the fact that, you know, the funding is so very precious that it's really important we spend that on those areas that are considered most important and will have the greatest difference to those living with mesothelioma. So to give you an idea of the timescale that we're working to, there are 3 main stages to this project. One being an evidence synthesis, 2 being a survey, and 3 being ranking exercises and activities designed to reach a consensus. And the end product of those 3 stages will be to publish a list of 10 research priorities for mesothelioma patient and carer research, hopefully in autumn this year. So going into July now, and we're on track. We've just completed the first 2 parts of the exercise. So the survey actually closed last Friday. And I'm going to talk to you a little bit more about each of the 3 stages now. So if I think about the first one, the evidence synthesis stage. So this stage was basically trying to draw on all of the evidence that is available to us now. In order to identify where the gaps are, we've got to know exactly what is out there. So there were 3 aspects to the evidence synthesis. The first was we drew upon the out of scope priorities from the James Lind Alliance. So those that were recognised as important but couldn't be included in their exercise. And these included things like delays in diagnosis, empathy at diagnosis, and the importance of communication, and the importance of the environment when bad news is broken. The experiences of carers, information at diagnosis, continuity of care, patient input, so patient understanding and informed decision making, the experience of pain, both as a result of treatments and as a symptom of the disease. So lots of important topics that we can draw on there. And we've also been reviewing the sources of grey literature. And by grey literature, we mean anything that hasn't been published in an academic journal. So statements, guidelines, such as the NICE guidelines, research reports, any reports or documents that have been published by support or charitable organisations such as Meso UK. And thirdly, we at the Research Centre have completed a rapid review of published academic literature. So this review asks the question, what do we know about the experience of living with mesothelioma from the perspective of patients and their family carers? So it was my colleague Steph, whom some of you all know, who led on this review, and the work has been submitted for peer review. So we hope that this will be available to you very soon. And it's by looking at what is known about the patient and carer experience that we were able to identify gaps in that knowledge. And we identified gaps across 8 areas. So I'll give you a very brief summary of each of those areas. Knowledge in these areas, both in terms of what is done well across the UK and what could be done better, have the potential to improve care for those living with mesothelioma. So under each of these headings, there were a couple of things that we identified as either being completely absent from the available literature or definitely lacking in terms of knowledge. So if we start with diagnosis, the diagnostic experiences of those living with peritoneal mesothelioma remain under research. Little is known about the immediate period straight after a diagnosis of mesothelioma is given. Occupational history taking at diagnosis is something that there is very little known about. So recording a person's work history at diagnosis to ensure that people have access to accurate and appropriate information regarding compensation. And the way in which a work history is taken may also have implications for how patients feel about seeking compensation, and if they do decide to pursue a claim, whether that claim is successful. In terms of the physical impact, in the literature, little has been reported about how to support patients to manage the physical symptoms of living with mesothelioma. Informal carers and family members are key to that experience, but their role in helping to manage symptoms has again not been fully explored in the research. And as the number of treatments and trials increases, we need a greater understanding of the physical impact of those treatments and trials on patients so that we can devise ways to reduce the negative impacts. In terms of the psychological impact, within various mesothelioma communities, mental health and well-being is frequently discussed. However, there has been very little formal research that focuses on mental health and well-being. So further research on that is definitely needed, and we identified that. Further research on the links between the physical and psychological symptoms is also required. So we understand that the onset of some symptoms, particularly breathlessness, can be very distressing for patients. So knowledge of which physical symptoms have the potential to trigger distressing reactions could help patients and their families to prepare for those, and of course professionals to better support patients and their carers. The impact of family relationships and carers. So current research shows a significant psychological, physical and social impact on patients and their families, but studies which differentiate between the experiences of patients and their carers are rare. And we found that patients and their carers have different support and information needs sometimes across that mesothelioma journey. So a better understanding of those support needs would be beneficial. In terms of self-management of mesothelioma, within the literature, patients reported using relaxation techniques, complementary medicines, dietary changes, exercise, or to manage physical and psychological symptoms. Yet little formal research has been conducted into what works well and for who. So learning about the ways in which patients and their families manage the physical and the psychological symptoms could help others in the future. And also from our discussions, it's clear that support groups provide a lifeline for many people living with mesothelioma, but the reasons for attending or not attending support groups has not been explored. So further understanding of these reasons may lead to support groups that are better tailored to a wider range of people. Healthcare professionals and systems, there was quite a lot that was identified as a gap under this topic. So one of those was unpicking the roles that different professionals play in supporting patients and their families at different points across that mesothelioma journey. So I guess healthcare professionals, legal professionals, asbestos support group professionals, and the importance of gaining some clarity there, who does what, when and where. And there is also a need to identify barriers and facilitators to early diagnosis, joined up care and access to end-of-life care. So discovering what helps and what hinders in those situations can lead to improved systems and access to existing resources. Mesothelioma care in the UK has improved drastically over the past decade, yet we know that there are still differences across the UK or inequalities in care provision in terms of mesothelioma across the UK. So exploring those differences is really important to make sure that people have equal access. Research participants from other studies have told us that attending appointments for scans and treatments can be really expensive. There's also a loss of earnings for some people. So the full cost of living with mesothelioma is at the moment unknown. And this may be another area that requires exploration. And of course, we can't avoid highlighting the impact of the COVID-19 pandemic. So we can consider that in terms of the impact on help seeking for initial symptoms, the diagnostic journey, the impact that that's had on living with mesothelioma and access to treatments and trials and bereavement. Treatments and trials, there is little evidence around the factors that influence the decisions that patients make around treatments and trials. So better knowledge of these factors may help healthcare professionals to better understand what is important to patients when making decisions, and that would allow them to tailor care and support appropriately. And findings from previous research has suggested that further work may be required to improve patient understanding of trials, and that will help to ensure that patients are provided with the appropriate information in order to make the most informed decision. So understanding both good and bad experiences of treatments and trials can help us to improve future experiences. And finally, asbestos exposure and compensation. Some of the things that we identified as lacking here were, why do some people choose to seek compensation and others do not? What makes things easier or more challenging to seek compensation? And once that decision has been made to seek compensation, who is most likely to be successful and why? So as you can see, there is a lot to be done, and all of these issues are important and have the potential to improve the experiences of patients and their families. So this exercise is really important because it's going to help us to prioritise which of these areas are most important for us to focus on now. So we then, we used these findings to inform our survey, and we designed an online survey and invited people with experience of living with mesothelioma, and anybody who works as a professional or a volunteer to support, treat or care for mesothelioma patients and carers to take part. So the survey had 8 short sections. One section was dedicated to each of the topics that I've just talked about. And at the beginning of each of those sections, there was a 1 to 2 minute video. So it's one of us from the Research Centre talking about one of the 8 topics very briefly. We then asked survey respondents to score each of those topics or those ideas or gaps that had been identified from 1 to 10. So with 10 being extremely important and 1 not at all important. And importantly, we also asked survey respondents to suggest any other aspects of the mesothelioma experience that they think require further research and have not been identified already in the videos. So that was really important for us to establish if there's anything missing. How did we reach respondents? We were very, very lucky in that we had such a warm and enthusiastic response from everybody in the mesothelioma community. A number of organisations supported the dissemination of the survey using newsletters, advertising the survey at events, emailing members, social media. We also have a wonderful steering group who are dedicated to this RPE, and there are 16 people on the steering group, and they each extended invitations to individuals and organisations within their own networks. So the 16 individuals all have valuable experience, expertise and heaps of enthusiasm. And there are 6 people with experience of living with mesothelioma, both peritoneal and pleural mesothelioma. And there are 10 professionals, all with either a clinical background, a legal background, specialising in mesothelioma, asbestos support group professionals, welfare advisors. So there's a wealth of knowledge there that we're really lucky to have access to. And as I said, the survey closed on Friday, so sadly we aren't able to share any of the findings with you right now. We'd love to, but we need to analyse those before we're able to. But I thought you may be interested to know that we had a wonderful 159 responses. So we are so grateful to everybody who took the time to respond to the survey. We really appreciate it, and every one of your responses is important to us, so thank you. In terms of who responded to the survey, we were slightly anxious that about reaching as many different people as possible so that we could try and draw on as many different experiences and expertise as we possibly could. And we're really pleased that we managed to reach so many different individuals, as you can see on the screen. So of the 159 respondents, just shy of 38% of those were people who had received a diagnosis of mesothelioma. Nearly 12% of those were family members or close friends of someone with a diagnosis. Just over 13% had sadly lost somebody, a loved one, to mesothelioma. 16% were healthcare or allied healthcare professionals. Couldn't fit the 5% on, but 5% were asbestos support group professionals. 9% were legal professionals, and the remaining 8.2% were other professionals or volunteers working to treat, support or care for mesothelioma patients and carers. So we were really pleased to reach a wide range of participants. In terms of the type of mesothelioma, I think this was something that we were really keen to try and recruit a sample which represented a wide range of expertise and the reality of living with a mesothelioma diagnosis. So a mixture of people who had been diagnosed more recently and those who have been living with the disease for a longer period of time. And having scanned the results very quickly, it does look like we've managed to reach a wide range of people, a wide range of ages. In terms of type of mesothelioma, we actually 37.9% of the patients who responded, or patients or carers who responded, had experience of peritoneal mesothelioma, which the majority were pleural patients, but the 37.9% is really high. So we should definitely be able to extract those results and be able to do some comparison work between pleural and peritoneal experiences. So I guess it was just an opportunity to say thank you to everybody who was generous with their time, and thank you for taking part. I think that was everything that I had to say about the who responded. In terms of the responses to the actual the scores that were given, we haven't been able to analyse them properly yet. The survey only closed on Friday, but I guess one of our concerns was that because all of these topics are so important, I mean, I've talked to you about very, very briefly about them all, and I'm sure you'd agree that they're all important. It would be very difficult not to give them all a 10 out of 10 for importance. So that was something we were really, we were a little anxious about, as to whether everybody would just rank all of the, give a 10 for everything. But actually people have mainly used the scores of between 7 and 10. But participants have used the full range 1 to 10 when scoring the importance of the suggested topic, so that's really great. In terms of the qualitative responses, so where we have said, is there anything else that you can think of that we haven't identified already, there are some really thoughtful, valuable suggestions that we're really grateful for. So we'll be analysing those separately. And yeah, so thank you, and we're very excited to share the results with you when we can. The next stage will be to, as I say, analyse those survey responses, and that will be an iterative process. So we'll be going backwards and forwards a little bit between the topic areas that have been suggested to us as ones that we haven't already identified, and we'll have to go back and check whether or not there is any literature available on that. Well, I suspect not, if that's something that people are identifying as something that needs to be improved, but we'll have to make sure. There will then be 2 online meetings with our steering group. The first online meeting is very soon, in a couple of weeks' time. So during that one, the research topics will be presented to the steering groups, and the group will then be split into smaller subgroups, and members will have the opportunity to discuss the research ideas. New ideas can be suggested at this stage, as long as they are relevant to the mesothelioma patient and carer experience. Anything new can still be put in the pot. And there'll also be an opportunity to clarify any terms and make sure that the steering group are satisfied with the way that we've categorised the research topics and ideas. So after that meeting, a list will be circulated to the steering group, and that list, we will then be asking them to rank the research topics in the list. So the research team will then synthesise the responses, and the 15 most highly ranked research topics will be carried forward into meeting 2, which will be in August. And meeting 2 will again begin with clarification and discussion of those 15 most highly ranked research topics. We will then pause that meeting as if we were in the same room and we could have lunch, but because of COVID, of course, we won't be. And we'll ask steering group members to complete a second ranking exercise. The group will then reconvene and generate a consensus on the final priority areas, so approximately 10. And the steering group will resolve any uncertainties that remain after that ranking exercise. For example, if 2 topics receive the same number of votes, the steering group will discuss the order in which they should be presented. And so at that stage, we will hopefully be setting our list of 10 research priorities. And following that, our job is to share those research priorities as widely as we possibly can. We will, of course, be disseminating the findings and the priorities at national and international conferences and events, and we will be publishing in a peer-reviewed journal. We'll also be working very closely with Mesothelioma UK to disseminate the findings to funding bodies and charities that may be interested in funding future mesothelioma research. So we want other researchers and, importantly, research funders to pay attention, because this exercise will help us as a research community to justify funding for more mesothelioma research and to make sure that that research is on a topic, an area that matters to those who are living with mesothelioma. So we're really hopeful that this exercise can make a useful contribution and improve the experiences for people living with mesothelioma. But we really welcome anybody getting in touch with us if you want to discuss how or make any suggestions about how we can share those priorities, who to, in what format. We're really keen to start that dialogue now, because it won't be long until we have those 10 priorities ready to share with you. So I think that was everything. Lastly, I'd like to thank the team and everybody who has supported the exercise so far, so especially our steering group members and those who have kindly completed the survey. We've had a wonderful, supportive and encouraging response from everybody, so thank you. And I'll hand back to Liz.
Lovely, thank you, Claire and Beth, so much. I think when Sheffield was awarded the tender for hosting the Mesothelioma UK Centre for Research, I think, you know, this just epitomises one of the reasons why, because you're just so thorough and professional about everything you do and dot all your I's and cross your T's. And I think, you know, money that's donated to a charity, you know, we in the ops team carry a huge sense of responsibility to make sure it is spent wisely and that we get the biggest bang for buck that we can out of that money to help people living with and, you know, navigating their mesothelioma journey. And I think what you've just explained to us all is such, you know, I couldn't have any better reassurance really that that we're doing everything we can to ensure that that money is going to be spent wisely and that the people that we seek to help are really having a say in how that money is spent. And I was part of the James Lind Alliance priority setting partnership that happened a few years ago, and you know, it was a great experience. You know, I think it was, you know, it was a real trailblazing experience. But you said, you know, almost apologized for us not being able to do things face to face. I actually think, you know, I remember the day that we identified the top priorities from that exercise, and there were patients, clinicians, scientists, charities, support groups, all sorts of people in the room. And not that anybody did anything wrong, you know, it'd be wrong for me to say that, but, you know, clinicians are very influential people, and you know, I can't help but wonder whether or not the priorities would have been any different if patients had been able to set their priority, you know, because it was a great surprise to me that there was very few symptom management palliative care questions that came out in that priority setting partnership, when day to day patients struggle with those issues. You know, we know that, those of us that work with patients regularly. So I actually think that it's maybe not a bad thing that this is virtual. You know, it's not a bad thing that, you know, people can really have their say without probably feeling as intimidated by other people in the room. But I guess time will tell, really. So we haven't had, have we had any questions come in? Very interested, thank you very much, blah, blah, blah. There are a couple of things I wanted to ask. So I wanted to ask about publication of the priority setting partnership, but you've covered that. I also wanted to ask about, you know, we definitely need to get the priority report out to funding bodies, you know, to Marie Curie, to Macmillan Cancer Support, Cancer Research UK, the NIHR, so MRC, palliative care societies and the likes, Hospice UK and all the rest of it. So I think we definitely need to send a purposeful email with the findings to these organisations. So and maybe try and, because I've always been a strong believer, you know, I'm a respiratory nurse by background. You know, I fell into cancer a bit by mistake, really, and stuck with it for 20 years now. But I've always felt, and I still believe this, if we can get things right for people living with mesothelioma, such as pain management, such as breathless management, if we can get things right, it can have an impact on all other cancers and many other respiratory diseases as well. So I think we need to try and get that across when we're contacting these funding bodies, so that they can see that it might be mesothelioma might be the focus, but the generalizability of those findings is pretty broad. So I guess a question I would like to ask is how much do you think this whole exercise might affect the Research Centre's ability to attract external funding? So how much do you think this rigorous process that you have led us through might be able to help us when we're applying to larger grant awarding bodies? And I'm not sure who of you wants to take that, but
yeah, I'm sure we probably both can say something to that question. And I think you're right, Liz. I think really important is obviously undertaking this exercise in a very robust way, but also thinking about how we disseminate it, and that is going to be absolutely critical to how well it's used. So I think we need to think very carefully about the plan for disseminating this information and getting it out there. You know, aside from aside from the publication in a journal, which is obviously important, think very carefully about how and where we take it. In answer to kind of the second part of your question, I think it will be really valuable to us in going to seek external research funding. Obviously, we do have the James Lind Alliance PSP at the moment, but a lot of what we do in the Research Centre doesn't really fit with the priorities on that from that piece of work. And that's absolutely not because what we're doing is not important. It's because, as Beth explained, it was focusing on a slightly different area of mesothelioma care. So yeah, I think having this robust exercise sitting behind any future grant applications is going to be really valuable. I think the other thing that is going to be valuable, and you made this point as well, is that it's not just about mesothelioma. And actually, if we're able to answer a lot of these questions about mesothelioma, those research methods, those designs are completely transferable to other types of cancer, potentially to other respiratory illnesses. And I think that also is something really important that we take to funders. And it might be that we end up putting applications in for larger projects that are not just about mesothelioma, but about other conditions as well, and which might be more appealing to funders who are looking to support as many people with a wide range of different conditions. But what we've done in mesothelioma is going to be transferable and generalizable to a wide range of different conditions. So yeah, I think it's going to really underpin in what we do, but yeah, massive value in leveraging funding as we go forward. I don't know if you've got anything to add to that, Beth.
I think the only thing I could add is that we've managed, well, because so many patients and carers just kindly shared their time and responded to the survey, we were hoping for 50% of the respondents to be from people living with experience of the disease, but there are far more than that. I think it's nearly 70%. So, and I think that's something that is increasingly important for people who fund research, to know that the research is underpinned by the experiences of people actually living with the disease. And I think that sometimes maybe patients and carers don't realise how important that is, and how significant that their voice is, and that it really, really does matter. So the fact that the research prioritisation exercise has that as a base is really valuable, and will definitely help, I think. Makes it more attractive to funders.
I don't think you could beat that level of engagement, to be fair, and getting over 150 responders, 159 I think you said, and I think nearly 38% of them are actually patients, and you know, which is pretty phenomenal. Do you know how many they had in the James Lind Alliance, just out of interest? Do you know how many responders they had to that?
Oh, we looked this, it was more than 159.
Well, I'm sure it was, but that's a much bigger, it really well funded, but you know,
I don't think it was hugely bigger. I think it was only a few hundred. It wasn't significantly bigger than what we've got.
Yeah, I think, you know, you should be really proud, and people are definitely saying they're really interested to see the results, and I really hope that we see some of the bigger funding bodies taking notice and looking at mesothelioma as an opportunity. And I think now that the team, and you know, Claire, you gave a great overview of what the team have achieved and what they've been looking at, and but you didn't mention, I don't think, I might have missed it, but you didn't mention how much collaborating and supporting collaborative work you're doing with other institutions, you know, that you're linking with other academics working in other parts of the country. Some of the we have 35 nurses now supported by Mesothelioma UK, and some of them are embarking on their own academic kind of aspirations, and you know, the team support them. So you know, there's even more going on than what you had time to present today. And you know, the public and the patient panel, you've opened that up to anybody and everybody. So clinical trials, all clinical trials, you know, have to have patient involvement, and we've extended a welcome to anybody setting up clinical trials. So it's a real service to the academic community behind mesothelioma, much wider than just Meso UK or Sheffield, which is a very needed resource, which I think is absolutely wonderful. So somebody has said it was refreshing to see peritoneal patients mentioned as much as plural as we're often neglected, and I can honestly say that Meso UK has been on that course for supporting peritoneal services for many years now, and it just feels like things are beginning to you know, come to fruition a little bit, you know, with what the Basingstoke National MDT and Sam Westbrook being in post, and Sam's been working really closely with the research team at Sheffield and Lorraine, and people living with peritoneal to get to really get a worthwhile research protocol together. So absolutely, peritoneal is very much in there, and we'll continue to do all we can to improve the evidence base for people living with a peritoneal meso. So there's been no further questions come in. We're about out of time. I just wanted to say a huge thank you, Beth and Claire, and to the whole research team that you work with, because it's just a real lovely team to be part of. I look forward to our meeting so much. I just wanted to also add that a few members of the research team are actually taking on an ultra challenge this Saturday. Lorraine and I are also doing it, but some of the research team are doing it. So we're doing an ultra challenge in the Peak District, and Claire is actually running it. So that's a real ultra challenge. The rest of us are going to be walking it. So if anybody fancies donating to and sponsoring us, then I'm sure you can pick something up off the Meso UK website, or not Meso UK website, Facebook or Twitter account. So big thank you both of you again. Thanks for everyone for joining us. And please do forward a link onto this presentation to any of your friends, colleagues or whatever. And the next Mesothelioma Matters webinar is going to be the last Monday in July. And we have Dr. Flavia Swan and her team, Cindy Ford and Alex Bullock from the University of Hull, who have led the CAN benefit study, which looked at the benefits of physical exercise and nutrition in cancer. And they're going to be sharing that study with us, and with a particular focus on the participants who had lung cancer and mesothelioma. Many of you will know how much the nurses, we harp on about the value of exercise. And this really should be shine a light on some of the evidence that supports that nagging that we do on a daily basis. So I hope the sun shines for all of us, not just some of us that mentioned it. Stay well, everybody. And thank you once again for all you do to support Meso UK and for joining us. And Claire and Beth, thank you so much.